Hi, my name is Emma Palmieri, and today I will be covering ecological studies and epidemiology. Understanding ecological studies. Ecological studies are a type of observational research that examines relationships between exposures and outcomes at the group or population level, rather than at the individual level. For example, instead of studying one person's diet and their heart disease risk, an ecological study might compare average fat intake and heart disease rates across countries. They're often used as an early step in identifying potential public health patterns. These studies are especially valuable when individual level data are hard to obtain or when we want to look at a large-scale social or environmental trend. They allow researchers to uncover associations that might otherwise go unnoticed, giving us a big picture perspective on how societal factors shape health. Ecological comparison studies. An ecological comparison study compares different populations at a single point in time. This could mean comparing states, nations, or even communities. For instance, researchers might compare air pollution levels in various cities and their average asthma rates to explore potential risks. These studies are efficient, using existing data and pointing towards broader social or environmental influences on health. Because of their accessibility, they're commonly used as a starting point for public health research, helping guide where more detailed, individual-level studies should focus. They're also useful for understanding how context and environment influence health outcomes, which is crucial when designing population-based interventions. Applications of the ecological approach. The ecological approach has real-world applications in public health. It helps identify risk factors that affect entire populations, like access to clean water or vaccination coverage. Governments often use ecological data to guide policy decisions or track health inequalities. Although it can't prove cause and effect, it's incredibly useful for shaping public health interventions and generating hypotheses for more detailed studies. This approach also emphasizes that health is shaped by multiple layers of influence, from individual behaviors to community structures and national policies. By understanding these layers, policymakers can address the root causes of health issues rather than just their symptoms. The ecological fallacy. However, a major limitation is the ecological fallacy. This occurs when we assume that relationships observed at the population level also apply to individuals. For example, a country with higher average income might have lower obesity rates, but that does not mean that every rich person is thin. Misinterpreting data this way can lead to misleading or unfair conclusions in research and policy. The ecological fallacy reminds us that correlation does not equal causation, and that population data can hide important variations within groups. Recognizing this helps researchers interpret ecological findings responsibly and avoid drawing simplistic conclusions from complex social realities. Implications and takeaways. The implication is that while ecological studies are powerful for detecting population trends, researchers must interpret them carefully. They're best used for hypothesis generation, not for establishing causation. Understanding their strengths and limitations helps prevent misuse and ensures that findings genuinely improve population health rather than distort it. Ultimately, ecological studies remind us that health exists within a broader environment, shaped by culture, policy, and shared behaviors. When used responsibly, they can guide smarter, more inclusive decisions that improve health outcomes for entire communities.